Hi, everyone. Welcome to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. We have a big show today covering the president's new executive order on prescription drugs, the latest developments in the fight to save Medicaid, and we'll discuss the impact tariffs are having on medical costs. Also, later in the show, we have an exciting guest on the Justin Mendoza is going to come in and help us understand exactly what the hell is going on with the Trump administration and prescription drug costs. Why don't we get into it? How you doing today, Rob?
I'm okay. I worked kind of late till after midnight. I got about 4 hours sleep and I got about 2 pots of coffee. So this is like living my best day. How you doing today?
I'm doing pretty good. I got a little more sleep than you did. I did not work in the ER last night, but
I think I'm also doing well because I didn't spend a lot of time scrolling through all the bullshit that's coming out of the administration.
Right, you were working instead of going through your phone.
I mean, people's personal tragedies and helping them through those. But oh my God, the other stuff is just exhausting. But yeah, let's get in it.
Great. Okay. So we had a surprising development yesterday, or late in the night the day before, Trump's new executive order on prescription drugs. So Trump issued a new EO where he claims he's reducing the cost of prescription drugs. I'm going to read a short excerpt from Axios. The executive order is light on details of how some of the policies will be implemented. White House officials told reporters on a call Tuesday afternoon that specifics for some of the initiatives, including how the Medicare prescription drug program will be changed, will have to wait. Perhaps the most noteworthy change asks HHS to work with Congress to fix what the administration calls a distortion in the negotiations for small molecule drugs, sometimes referred to as the pill penalty. Further delaying Medicare drug price negotiation would lead to higher prices for patients and taxpayers, not lower ones, said public citizen drug policy advocate Steve Knievel. Big Pharma is happy with this development, despite so many folks in the mainstream media and across all sorts of platforms saying, basically taking the EO at face value and saying that he was trying to lower prescription drug costs. What's your take?
Well, like what they do is not a surprise, right? On every issue, they just say the opposite of what is true if what is true doesn't comport with how they want to present what they're doing. That's not a surprise. I'm blown away that every headline, maybe save a couple of pieces I saw, led with EO to lower prescription drug prices, right? And that isn't what this does. And pharma, right? One of the most profitable industries. I mean, just raking in billions and billions of dollars going up every damn year. My patients can't afford their drugs. They want this. This is not good for patients. This does not lower costs. And we're going to have Justin on later to explain that. Justin is the ED of the university's Allied for Essential Medicines, essentially a group trying to lower drug prices. And he's smarter than we are on this specifically, and he's going to get into that for us. But yeah, it's just another kind of fake out on this administration's part, and the press played into it, unfortunately. What do you think? I mean, how do you think this plays out there?
I mean, I guess I had three thoughts about it, like right out of the gate. The first one was my healthcare policy thought. And so I read the headline, and we're all susceptible to a lie, at least until we apply critical thought, right? And I'm like, oh, okay, that's good. It's good to lower prescription drug costs. And then I sort of had my political thought. That is a politically potent issue. That is bad. If Donald Trump is actually lowering prescription drug costs for politics, it is good for people. It is bad for politics. And then I had my hat on of a person who's lived in this country with Donald Trump being very prominent in it for however many years, 7, 8 years. And it's like, there's no way this could be true. This is like, I'm now skeptical, and now I got to dig in. And I wish everyone would have approached it with the same skepticism, because as soon as you see Pharma's reaction to it, like, oh no, this is Trump and Pharma getting cozy with a misleading headline on the EO, and that's what a lot of these EOs are, right? They're just press releases. They are not public policy.
Right.
And so I think we saw that, and I wish more people would have evaluated it critically. So luckily we're going to do that later today in the episode.
We're going to do that. So. And the way they roll these things out is always so telling, right? I don't know that he knows what these are, because when they roll them out, there's a person, kind of like the town crier, who stands up and says, "Mr. President, this is to blah, 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 blah," whatever. And then he does his little kind of EKG signature, and then that's that. And then unfortunately the reporters just kind of roll with whatever they said. So yeah, I'm glad you broke down how you address this. I think I started at the bottom part and looked and said,
Yeah,
that's
he just went
bullshit. There's no
straight
fucking way
to
these guys
skepticism.
lowering drug prices. There's no way. Like, like that doesn't help out the people who support them, right? Big pharma CEOs and all the big corporations. But I'm glad you went through it maybe a little less jaded way. I'm a little older than you, but you've been in politics longer than I, so I guess I'm surprised by that. But that's nice. That's refreshing. You're not completely broken by the system yet.
That's right. So the EO did one other, the EO is attempting to do one other thing, or I'm not saying the EO does things. The EO is saying that it would like to do this.
Yeah.
The EO also directs the Food and Drug Administration to streamline approval of generic and biosimilar drugs. This seems to be counter to the Trump administration's elimination of the FDA's Division of Policy Development in the Office of the Generic Drug Policy. Amid the hard to follow cutbacks at the US FDA, a little known but important office was eliminated. Completely eliminated. And the implications will be felt not only by drug makers, but by consumers. The Division of Policy Development in the Office of Generic Drug Policy, which was created more than a decade ago, was responsible for a host of activities that were central to ensuring generic drugs were approved properly for the American market. So you have the administrative entity that does the work of approving the generic drugs being completely eliminated, with just this pablum coming out of the White House saying we're gonna go after more generic approval of generic drugs.
Yeah, it just tells you, like, really. So I write orders at work, right? That's what you do. You put in an order to get someone to get a medicine or to get a test done. And if the orders we do were like what their executive orders are, it would more be, well, I would certainly hope this patient would get morphine for their abdominal pain, and hopefully somebody out there will help make this happen at some point, because they're just basically wish casting into the void of, into the receiving arms of the media that is kind of putting it out there to people that this is reality. And then what you just said, they've, on the other side, work to gut the systems in place that could actually do the things they are suggesting they would like to do. So they never get done because they don't want them to get done, but they get a little credit for hoping they could possibly happen at some point. And it's fucking maddening. Like, I don't know. I don't know where to go with it. I think we just got to keep like pressing and telling the truth and having these conversations, and hopefully more people will have these conversations so we can see like whose side they're actually on. It certainly isn't the people who can't afford drugs.
Okay, more to come on the back half of the show with Justin Mendoza, and we're going to dig on the prescription drug issues more. Let's go on to what I'm calling hot Medicaid summer. People around the country are trying to save Medicaid. Physicians around the country are trying to save Medicaid. So we have some updates. Republicans continue their charade that cutting waste, fraud, and abuse in Medicaid and kicking able-bodied people off the rolls will be enough to pay for the $880 billion in cuts that they are demanding to pay for a massive tax giveaway to billionaires and giant corporations. House Speaker Mike Johnson said so explicitly now. Republicans seemingly made it official over the weekend that they're going after Medicaid, despite assurances from a wide range of party figures, including Donald Trump. It appears that the upcoming GOP budget proposal will include cuts to Medicaid. We knew that. Now it's explicit. They said it wasn't going to include Medicaid cuts. Now they're saying it's going to include Medicaid cuts. What's your take?
Well, I mean, they are taking an essential program that provides health care to 80 million Americans, including 60% or more of seniors in nursing homes, including 40% of births, right? Nearly half the kids out there. They're doing that. And they're doing it by messaging. Like, they're playing cutesy with it, saying, well, we're not going to cut Medicaid. We're just going to make it more efficient. We're going to make sure people who shouldn't be getting affordable health care aren't getting it. And first, as a doc, I'm like, well, what the hell kind of monster are you to say people shouldn't be getting affordable health care? Every person should be getting it. Our system sucks so that every person isn't getting it. And folks like us in the advocacy world are pushing and working with legislators to make it a better system. But these guys, one, like work requirements, that's going to be a thing they're going to talk about. And they're going to try to pigeonhole, I think, Democrats or an advocate saying, well, don't you think that people should work? And the answer is, they do work. The vast majority of people on Medicaid do work. And in states where they've instituted their so-called work requirements, all it has done is taken people who are working and abiding by all the rules and kicked them off Medicaid because of bureaucratic red tape. The party of DOGE, the party of smaller government is taking a big government solution here to cut people off of healthcare. And it's crazy. We got to call them out. We can't fall into their little framing trap, because that's how they think they can make it look like they're not cutting Medicaid. That's what they're doing. They're cutting people off healthcare.
Yeah. I have a new rule when I read the news, that when someone says waste, fraud, and abuse, I think that person's lying to me
Yeah.
at this point. I mean, we just haven't seen like anyone who's saying waste, fraud, and abuse is one, not finding a ton of waste, fraud, and abuse, but especially when it comes to the healthcare programs, when they say waste, fraud, and abuse, it's such a red herring because it would have to be such an extraordinary amount of waste, fraud, and abuse to get to 880 billion. There's just no path to do that. And so it's such a fig leaf for a red herring. And, it speaks to I think it speaks to like how truthful they're being on a whole range of issues that you could like say with a straight face, something that is such an obvious lie in the math.
Yeah. I mean, if they wanted to go after waste, fraud, and abuse within the healthcare system and government spending, they would get rid of privatized Medicare, so-called Medicare Advantage. They would do that. They just increase that, right?
Yeah.
Taxpayers pay 20% more for those privatized Medicare plans. Now, more than half of seniors are on these plans. If they really want to get rid of the waste, the fraud, and the abuse, there you go. But no, they don't want to do that because they're giving too much money to, United Healthcare and Aetna and all the big pharma folks. All the big insurance folks, big pharma, big insurance, lots of people out there making big money off of healthcare.
Yeah.
They don't want to really do that, right? They just want to kick poor people and working people off of healthcare so they can give tax cuts. And we got to keep saying that because they say the opposite all the time. Well, we're not giving big tax cuts to billionaires. Well, they are, right? They want to extend the Trump tax cuts that threw us into massive debt. In his first term, they just want to keep that train rolling and probably add on to it to give these big tax cuts. He promised it when he was running. He got them all in a room and said, "You guys elect me, I'll give you billions in tax cuts." They're trying to make good on it.
Yeah, they are trying to. And it seems like they're making progress. I will say, Rob, we're doing this because we want to help people understand the healthcare news and the power and the profit sort of behind what's happening in healthcare news, but also what you can do about it. One of the things that has been exciting about Hot Medicaid Summer, or as we get into it, is that millions of constituents are rallying around the country.
Yeah.
In particular, the hands-off Medicaid protests that have been happening have been really exciting. I know the Committee to Protect Healthcare has been organizing events. We know that a number of different organizations have been organizing events across the country to hold Republican congressional members' feet to the fire on their promises to not cut Medicaid. West Virginia Republicans said they wouldn't cut Medicaid. Then they voted to cut Medicaid. That was in the Mountain State spotlight. And
wait, Republicans said they weren't going to do something, then they did something.
Yes, that's what happened.
Go ahead. Go on. Next. Yeah.
But more on recalcitrant Republicans from the Hill. Moderate Republicans draw a red line on Medicaid cuts in the Trump agenda bill. Vulnerable and moderate House Republicans are warning House GOP leaders that they will not support one big, beautiful bill encompassing President Trump's legislative agenda if it includes cuts to Medicaid benefits. So the dynamic we have is the Speaker of the House is explicitly saying we're going to cut Medicaid now. You have a number of the vulnerable Republicans, the Republicans who believe they could lose their seat in the midterms, newly saying that we're not going to support a Medicaid bill. And that is on the heels of people bird dogging them and bothering them at their events and going and holding their feet to the fire. That is real progress. I know it feels like so much is coming out of the administration that people aren't making progress, or we're just sort of like losing slower as opposed to being able to stop some of the most egregious things. But this is real progress inside of the Republican caucus to say, no, we should not have Medicaid cuts in the reconciliation bill. I think that's thrilling. And I hope people keep at it because there's a real path here to stop Medicaid cuts. What do you think?
Yeah, but again, be careful because you said it right in what you're talking about. They said we will not cut benefits, right? And so they're playing footsie with messaging on the backs of people gutting healthcare. So they're going to say work requirements aren't cutting benefits. It's just getting people off of Medicaid that shouldn't be there. The people who should be there, no change. When they're going to go after expanded Medicaid in the expansion states under Obamacare, under the ACA, that's where they pay, the federal government pays 90% of costs of Medicaid versus the 50 to 70% they pay under normal Medicaid. They're not going to say, well, we're cutting benefits. We're cutting the reimbursement to states. States can keep those people on Medicaid and give them the same benefits, but we've heard from state legislatures, Republican state legislatures have sent letters to their Republican members of Congress saying, you can't do this to us. We cannot make up the difference, right? You will bust our budgets. And most of them have a constitutional requirement to balance their budgets. So it's playing footsie with messaging on the backs of poor people losing health care. And we have to call it out and hold their feet to the fire on what is actually a cut.
Yeah, I think that's right. And just to maybe dial in on this operative sentence in the Republican statement, we cannot and will not support a final reconciliation bill that includes any reduction in Medicaid coverage for vulnerable populations, which that sentence alone leaves the door wide open to work requirements. So we see where this is going.
Just monsters.
Yeah.
I don't know. I don't know how they go to bed at night or how they go home at night, but
Yep. All right. Any last thoughts on Medicaid, Rob?
just, I mean, I've been doing ER for 25 plus years. I work in a poor rural community. Our hospital depends on Medicaid. So many patients do, but the thing that people don't want to talk about so much, particularly these members of Congress, is when they cut Medicaid, it hurts those people who lose that coverage, right? Some people might look at it and say, well, I don't know, I get insurance through my job. What do I care? Or I'm on Medicare. What do I care? Or, I can't afford it anyways. But the problem is, particularly in rural communities, but also in other communities, the system itself depends on having people who can actually pay their bills. So before the ACA, before expanded Medicaid, so many people, 20 plus more million uninsured people at that time, they'd come in, and in the ER in particular, we see them. Federal law mandates it. And if they couldn't pay, they couldn't pay. So medical debt went up. All the GoFundMes kind of really got rolling at that time to pay for medical bills. But hospitals didn't collect for the large part. Probably 90+% of the bills they put out on people without insurance just didn't get paid. And if that Medicaid piece goes away, it not only hurts the Medicaid recipients, it hurts the community, shuts down. I mean, hospitals are going to close, clinics are going to close, delivery, labor, maternity units are going to close. And that's going to affect everybody. People with insurance on the ACA, work insurance, Medicare, they're not going to have their hospital. They're going to have to drive hours and hours to get care. They're going to have longer transit times when they're having a stroke or heart attack. This will have a ripple effect. And we have to remind people of that too, because if they're just going to think selfishly about what affects them, this affects everybody. It's not just the people on Medicare.
Yeah, that's great. I guess my last thought on this is for the physicians or the healthcare providers or any other activists who are listening to this podcast, please keep it up. We're going to, there's going to be events in congressional districts across the country for the foreseeable future. Please participate in them in ways or as small ways, big ways, however you can participate and get involved. And if you want to take action, you can go to www.committeetoprotect.org and find some of the actions that are upcoming. So,
Amen.
All right. On to tariffs. You may. That's exciting.
Are they on? Are they on? They're on. They're off.
They're on. Some of them are.
Some
on.
of them are on. Okay.
10% across the board have not gone away. The tariffs on China remain above 100%. Trump's actions on global trade are going to have a negative impact on healthcare. It's not like the healthcare market is immune from the global market. Politico quoted Trump says major pharmaceutical tariffs are on the way. President Donald Trump said Tuesday that pharmaceutical imports will soon be hit with major tariffs as part of his efforts to drive manufacturing back to the United States. Drug imports evaded the first round of tariffs that Trump imposed on countries around the world, but the president said they will not be spared. We're going to be announcing very shortly a major tariff on pharmaceuticals, he said at a dinner at the National Republican Congressional Committee. And when they hear that, they will leave China. They will leave other places because they have to sell. Most of their product is sold here, and they're going to be opening up their plants all over the place. What on earth? What do you think this means for, we just talked about how he's sending out EOs to lower prescription drugs. What would tariffs on pharmaceuticals mean for access to prescription drugs?
Well, unlike the kind of wishcast EOs that we see, right? Tariff, like he can do that, right? By law. And Congress has kind of given up any of their authority
abdication
completely, right? And so he can do it. I mean, we've all heard a lot about tariffs and, kind of the folly of thinking that in the short term, or even the near term or midterm of this, that all of that manufacturing and all that could come back, right? If you're going to try to have a targeted tariff policy to bring back industry over years and years, and you invest in those industries, 20 years down the road, maybe we're making more refrigerators and cars and microwaves here in the US. And maybe we're making more drugs. Yeah, sure. Okay. So what does grandma do when she can't get the med or it just gets jacked up, twice the price, and there isn't a plant, here in the States ready to make that drug the next day or month or even year, a multi-year kind of ramp up process to get these things manufactured. Unemployment is low. Where are all these workers? I mean, we're going to take all the scientists that left the NIH because they got cut by Doge and they're going to now go and just kind of work in the plants. I don't know how this works. And I think I did see some reporting on a blood thinner called heparin that would have a major impact on this drug. And any docs or healthcare folks listening to this, they know what heparin is, and other people may. It's a blood thinner you give in the hospital through the IV when you've had a heart attack, when you have a blood clot in your lungs, life-threatening things. Also, importantly, if you're having bypass surgery, when they take your heart and lung function and transfer it to a machine for a period of an hour or so as they're doing their work, you have to be on heparin or everything clots off and you die. So what happens when we run out of heparin, right? I mean, we stop doing these things, right? We're not going to put people on these and just let them die. Like, this is bonkers. I mean, all the tariff stuff is ridiculous and it's wreaked havoc on everyone. Obviously, everyone listening here has had an impact, I'm sure, in some way. But this is like so dangerous. And this is going to lead to people getting sick and people dying because lack of access to drugs that we just can't make the next day here in the US.
Yeah. One of the reports that I was reading, I think kind of articulated this really well. Bloomberg was reporting that the administration's investigating into drug imports announced Monday, widely seen as a first step towards imposing levies on the industry, could actually be beneficial. J&J Chief Financial Officer Joe Walk said in an interview, the investigation is likely to show most medicines shipped to the U.S. are cheap generics, not the innovative therapies sold by J&J. And so essentially, a lot of the pharmaceuticals we're importing are generic. The pharmaceutical companies have made their profits. They've moved to generic. These are low-cost drugs, and it is simply going to raise the price. The idea of reshoring these plants to create generics, like in any amount of timeline that's workable, seems absurd.
Well, no one's going to do it because the profits aren't there. As long as they're able to just,
I mean, because they're going to leave it offshore and then just pay just double the price. And
most people are, they're on a drug, right? There's an alternative they could take that has been developed recently that's more expensive, but not any better. And that would be their only option. Or in most cases, it'll just be not to take the drug, really.
Right.
That's the reality. So, wow, thanks, Miles. I was doing okay.
Yeah, no, sorry about that. No, it's dumber and dumber.
It's another proof point that these folks aren't on the side of regular people, right? They're only thinking in terms of how they can enrich the people who are already super rich.
Yeah, that seems right. Why don't we end with our lightest topic? No, just kidding. That's a joke. It's about RFK. Robert F. Kennedy had a quote about autism that was absolutely bonkers. Why don't we throw to that now? And I would love to get your reaction afterwards.
These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children.
That's enough of that. What the holy? What is your reaction to that, Miles?
My reaction is, as a non-scientist, I just know that's not true. That is a comment that is not true. It is not grounded in my experience. It is like a visible lie, like out in the world. That is absurd. Yeah. And this idea is sort of like ginning up fear, and it's hard to tell whether he himself is confused about the matter or whether he's sort of playing to his Maha base, and whether he's sort of sowing fear, doubt, and confusion in order to pursue his political agenda. I don't think it really matters. Whatever motivation he's pursuing, it's harmful in either direction. What do you think?
Well, give him the benefit of the doubt.
Yeah.
Fine. He is ignorant. He has no freaking idea what autism is, right? It's autism spectrum disorder, right? That's the technical diagnostic term, ASD. It is a spectrum. There are some individuals with severe autism that are disabled, that cannot function independently. That is a fraction of people on the autism spectrum. I mean, Elon Musk, when he was on Saturday Night Live in 2021, said, I am the first host with Asperger's. That is a kind of further on the maybe less severe or sort of higher functioning spectrum of autism spectrum disorder. You know, the historical figures, I was doing some research before this about this, because like people, they don't know, but people surmise people like Einstein, Nikola Tesla, Isaac Newton, like the hyper-focused, kind of not socially integrative folks, Mozart, people who didn't interact well with others, but like in one particular field were the top of their field. That is a very characteristic of Asperger's, of people on the spectrum in that range. And though to suggest that this group of people diagnosed with autism can't do these things that he just said, I mean, it's insulting to individuals, to parents. It's dangerous, right? Because now it tells people if they have a child that is they're told they're on the spectrum. Now they're preparing for a life of, forever caring for this individual. It's just not true. So if we gave him the benefit of doubt, he's just ignorant. What the hell is an ignorant person like this doing running HHS and spouting off like he is from the bully pulpit? That's a real problem, right? The American Public Health Association came out, I think this week it was, and called for him to resign or be fired because he's both ignorant and completely dangerous and unhinged when it comes to, paraphrasing what they said, but when it comes to healthcare, public health. So I think we all have to push back against this. Another thing we got to do. So if you take it that like most benign, he's just stupid. The least benign, right? That he has an agenda. Well, he's made a lot of money off of suing pharmaceuticals over vaccines. He's still got a hand in that. And yeah, you can see a world where he's just ginning up fear about a disease that isn't caused by the thing he says is causing it, and then investigating that with who knows who. We do know who, right? Anti-vax conspiracy people are investigating this and then putting out what they call data and trying to convince the public that what they're saying is true. So it's up to us, up to public health folks to push back, keep talking, but it's maddening. I don't know where we go on that.
I don't know if there's much more to say. I think I don't give Robert Kennedy the benefit of the doubt.
Okay.
I think it's generous to do that. I think it's good to game it out if we do, but I don't give him the benefit of the doubt. I think he's been a bad guy. His family calls him a predator.
Yeah.
It strikes me that he's pursuing an odd agenda in there. And, it's not just a ham-handed way to describe autism. He is pursuing fear, doubt, and confusion in order to try to achieve some sort of political ends that honestly, I don't actually understand the political ends. I don't understand what he's trying to get to. Maybe he's just trying to make himself rich or consolidate power, which seems like the motivation most of the time.
It seems like the motivation of a lot of the bad players. Which are all of the players in the current schemes. I guess we'll just kind of keep an eye on RFK Jr. because he does say some just quirky things that just make you scratch your head every once in a while because he's just like a weird dude who doesn't have a grasp with reality. But then very often he comes up with these real dangerous things that I think he has to be called out.
Yeah. That's great. All right. Well, this is completely depressing, Rob. Why don't we wrap up with something that you can do as a listener if you want to take action. So if we're going to put it in the show notes when we publish, the Committee to Protect Healthcare has a Medicaid action page where if you are a physician or a healthcare advocate, you can take action there. You can call your representative. You can record a video testimonial, and you can contact a campaign staff if you're interested in getting involved if there's an event in your area. So we'll put that in the show notes. Please take a look. And then we'll throw to Justin.
Great. All right. I want to welcome our guest here today. It's Justin Mendoza. Justin is the executive director of Universities Allied for Essential Medicines and also on the board of the Committee to Protect Healthcare Education Fund. Welcome, Justin. Would love to just kind of hear about UAM, Universities Allied for Essential Medicines, and then we kind of want to get into talking about this most recent EO.
Awesome. Thanks, Rob. It's wonderful to be here and great to connect. So UAM is an organization that was founded in 2001. Our focus is really on getting researchers, students, and faculty members on university campuses engaged in the conversation about prescription drugs that are discovered on their campus. Right now, about 99% of the medicines that have been approved by the FDA over the past decade were discovered in laboratories funded by the U.S. government. Taxpayer dollars are going in, producing these products, and then we're charged exorbitant prices. And we have an approach with universities that can lower the costs when something's discovered on campus. So that's where we come from, but we weigh into prescription drug pricing fights and have been for the last 2.5 decades.
That's great. Because I mean, you guys do great work, and I've been on panels with you talking about prescription drug costs, and you bring fire to it all the time because you're smart and you can talk about it. So we talked a little bit, Miles and I, in our limited capacity as political experts and a physician who knows a little bit of policy about the most recent Trump executive order or whatever we want to call it. About prescription drug prices. Can you, I guess, just go with it? What do you think? What's it all about?
Yeah, so my first take on reading this thing, and it's kind of lengthy for an executive order, so there's more to it. But two things. One is we've seen a lot of this before. The Trump administration, in their first go, claimed a lot of credit for prescription drug pricing reforms and things that they were going to do. They talked about putting in reference prices. They talked about improving imports. They talked about all the greatest hits that are in the first section of this executive order back then. And you don't have to search very far if you just use the keywords from it to find what all the experts thought. And essentially, all of these are mixed bags. None of these will directly lower costs. None of these will damage industry's profits, which isn't the goal, but sometimes is the result if we actually lower costs for patients. And none of these things will truly change the cost when you go to the pharmacy counter. That's the biggest thing. So all these proposals, to me, this is another political piece that he's putting out there. I mean, we've been polling for 2 decades, not UAM personally, but the drug price kind of groups out there have been polling for decades about how Americans think that we need to lower prescription drug prices. And they can see those polls too, since they're public. So we have a political piece here that's just saying, look at all the stuff I did last time. Biden took it all away from you, and I'm going to bring it all back. And that's really all this EO is when I look at it. And then there's some specific policy points too. But to me, it's, if you're ever in a group project and you finish all the paperwork and you've written maybe 30-40% of it, maybe even half, and one of your colleagues turns it in and tells the professor, I wrote everything, and everything that Justin said was something I had to correct. That's what Trump's doing here with this executive order.
Man, we specifically didn't invite a friend of mine's boyfriend to our wedding because he did that on a project in my open college. So yes, I know what that is. And that seems like the kind of guy Trump is. I know I have just one more question. Why, and then Miles, if you have anything certainly on it, why was Pharma supporting this? Why is Pharma happy? Because usually if Pharma's happy, that's not good for my patients.
Absolutely. And that's true here too. So Pharma liked almost every proposed reform to prescription drug pricing in the previous Trump administration. And they're really happy about one piece in this one, which is in the Inflation Reduction Act, right? There's this waiting period for when a drug can be negotiated. And they have crafted a bill that's currently sitting in the US House that would change that waiting period to make sure that small molecule drugs, the simple things to invent, like aspirin, though that one's no longer being negotiated, but something that easy, would be held off from negotiation as long as a genetic therapy. They're saying like all drugs need the same rules. And from the patient perspective, Pharma's dead wrong on this. One, these drugs are simpler to make, they're easier to manufacture, and by the time they're being negotiated, the monopoly and the recoupment on their investment is done. My favorite example is Gilead making a hepatitis C drug in 2014. They purchased it from a smaller company for, I think it was 12.1 billion, or maybe it was 11.1 billion, somewhere in that area. And within a year, they made back 100% of their investment. In a single year. I mean, that's the kind of drugs that they're saying we need a longer term on before they can be negotiated. And yet, in reality, if we wanted to make the rules even, which maybe we should from the Inflation Reduction Act, the more complicated drugs should have the exact same terms as the simple drugs, and it should be 9 years. And it's the exact opposite of what Pharma wants. So they're cheering this on because for them, where 70% of their market is in these simple drugs, this means billions of dollars for their shareholders coming directly out of our pockets.
And so, Justin, just to put a finer point on that, so for those small molecule drugs,
Yeah.
essentially, this does nothing to lower the costs of those. What it does is it creates a longer timeline for the cost to go down. So it's actually doing, for that category of drugs, it is doing the opposite of what the headline on the EO said.
100%. Yeah, for that category of drugs, it will actually maintain higher prices for 4 years longer than the current law.
This is what got me so fired up about how a lot of the media covered this, is because they basically took the EO at face value. And I was telling Rob, like I go through sort of a series of ways that I evaluate these EOs that almost always arrive at like, this is just bullshit. That strikes me as like the heart of the matter, that if it really does take the timeline and extend it out, that it's a fake headline that they slapped on a pretty normal Republican proposal to give a giveaway to pharma.
Absolutely. Yeah, and and they snuck it in there with other things that like during the original Trump administration, Trump 1.0, I guess you could say, they put out a proposal to put in closed loop formularies, a complicated term for letting letting an insurance company, exclude patients based to lower their overall costs. They put together a proposal to experiment with that in Medicaid, and that's referenced here in a passing statement, which that would mean for the lowest income people in the country, sometimes they might go to the doctor and be told, "Oh, that drug's not covered anymore," because they're negotiating for lower costs rather than what Medicaid does now, which is cover everything that's medically necessary at the lowest possible cost. So it's worse for patients, no better for the government, according to multiple analyses. And yet that's mentioned here too. And these things that just keep being proposed because they're things that make shareholders of massive pharmaceutical corporations happier.
Well,
Yeah.
we had a kind of a dark conversation earlier, Miles and I, because things seemed a little bit bleak, and we're hoping you would kind of lift that up a little bit. So far, no good. But what can people do, right? What people listening say, physicians, advocates, lay people just out there, who want to be able to afford medications for themselves, their family. What can they do? You think?
Yeah. Well, they can make noise.
Yeah.
I would say calling your U.S. congressperson, calling your senators, and pushing them on this is huge. Showing up in person during their recess. I mean, they're about to go on recess in April. They've got another one in May. If they have a town hall or if they have a coffee hour, go there and ask them what they're going to do on prescription drug prices and tell them not to support the EPIC Act and to really question this executive order. In the previous Trump administration, with the previous Congress, we were able, as mostly people, to stop a number of these proposals in the past that cut in the wrong direction. We were able to get some stuff done that actually helped lower monopolies on prescriptions, but we also stopped a lot of this bad stuff that comes from the Trump administration, the stuff that's just there to grab headlines. And we can do that again because these weren't partisan issues then. They aren't partisan issues now. There are a lot of Republicans who don't support these proposals, and they just need to be reminded that their constituents don't have space to pay more at the pharmacy counter.
Yeah. Justin, when it comes to the EPIC Act, is that something that forgive my ignorance on this, is that something they're going to attempt to do on reconciliation, or do they actually need to get it through the Senate? And so it makes it a little less likely that they'll pass it?
Forgive my ignorance on this too, actually, because I'm not sure where the strategy currently stands.
Yeah.
It was originally introduced as a standalone, which would then take it going through the Senate, but it's all about expenditure if you frame it the right way. And because the original bill it's modifying was passed in reconciliation, it's got a reconciliation path. So it's
Okay.
very possible that this moves that way, which it gives us all a limited window and limited ability to stop it. But it will mean that despite us passing historic Medicare negotiation, simple drugs are going to take longer to negotiate if this passes.
Yeah. I mean, they're going to do something bad, right? They're going to make costs go up and cut people. It's just going to happen.
Yeah.
Some of it is we need to do everything we can to limit that, right? We would love big victories. We will have to also fight for, so I think that this is still something that they need to be reminded about, as healthcare costs go. Prescription drug costs are front and center. It's sometimes hard for patients to understand deductibles and copays and how that connects with premiums. And it's how Medicare Advantage is such a grift because people pay almost nothing. And then in the end, when they get sick, they're going bankrupt. Drug costs are like right there in your face when you go to the pharmacy. And so that feels like something people can really weigh in on and tell stories that are meaningful and can hopefully move some of these soulless members of Congress to maybe do something a little bit right once in a while.
I guess the thing I'd add on here too, the real peril in this is ceding drug pricing to Trump and to the Trump administration. Like you have RFK giving sort of gauzy gauzy policy solutions to lower prescription drugs that aren't even really policy solutions. It's just like a expression or sort of orientation that's vaguely negative towards pharma. And then you have the Trump administration saying they're going to lower costs. And what I'd say to patient advocates and other healthcare advocates, as well as Democrats who are sort of in opposition, is do not cede ground on prescription drug pricing. One party has done something to lower prescription drug prices in the last 8 years, something significant, and the other party threw up roadblocks every single step of the way. That's the Republican Party. And so it is extremely politically popular. All the Democrats are all, in a pretzel trying to figure out how to talk about costs. Prescription drugs is the big cost for a huge portion of America. So do not cede this. This is one of those things where Trump's lying. It's a bald-faced lie, and we have to say that it's a lie, and we can't really mince our words about it.
Yeah, absolutely. And I would point out, even in this, like, he uses some language that sounds like language that Democrats have used, right? Like, he mentions reference pricing, which is where you try to pay or try to make sure that in the US we don't pay more than other countries. But the devil's in the details. The version of Trump reference pricing, there are lengthy policy papers on how it wouldn't work. The references that they were looking at are the wrong countries. They have completely different standards. And what they would set is a much higher cost than what we should be paying based on the R&D we put into it. And the administration always refuses to look, or at least the first Trump administration refused to look at the cost of research and development that was actually being paid in. So the return on investment, where we've invested our money every single year when we pay our taxes, every single day or hour you work, some of that money is going into developing new drugs, and then we're getting charged for them. And the administration has never taken a stance to actually factor that in.
So that's great. And man, we really appreciate being here because I understand this better. I don't know about you,
I do.
Miles.
I understand it a lot better. Thanks, Justin.
Yeah.
We hope you'll come back, and next time prescription drugs are in the news, and it seems like it'll be in the news quite a bit in the months to come.
And we appreciate you individually, but UAM as an organization being kind of on the front lines of this for over 2 decades, and trust that you will continue to do that. And just, let us know. Let us know when you got something you want to talk about, and we're happy to have you.
Awesome. Thanks for having me, Miles, Rob. It's awesome to be here.
All right, great.
Thanks so much, Justin. All right, Rob, I'm going to read us out. The show was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. Produced by Amelia, Dylan Schneider, Aslan Ibrahim, and Joel Bryson. Music by Annette Somerset at Dune Flower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. And we'd love your feedback. Send your comments and suggestions to feedback@pagingamerica.org. Thanks for listening, and see you next time.